Hi, good morning. My name is Shazia Khan, and today's unit that we'll be doing is the access to higher education, social issues in healthcare. That's the actual the actual subject around it. And the unit that we're doing is the principles of safeguarding in health and social care. And this, I've just put the assignment brief on just to show you how it actually looks, but we'll do more of that when it comes to looking at the assignment discussion towards the end. So this is just about the assignment and stuff. So you can have a look at this in your own time, and it's available on Moodle for you, okay? I'm just going to start with the session now. So we're going to go through the first learning outcome. So the learning outcomes will be each week, tomorrow we'll do one learning outcome, and then we've got another one, another two next week, and then it follows on from there. So we'll go through each one so you've got a little bit of an understanding of what to do. Can you see the slides now? Bizan, are you okay? Bazian?
Yes, I'm good.
Okay,
Thank you.
excellent. Thank you. So the unit we're doing today is principles of safeguarding, and we're looking at elements of a unit one, which is learning outcome one, which is to look at understanding how to recognize signs of abuse or harm. My name's Shazia Khan, so if there's any questions or anything you need to ask me throughout the sessions, we'll go through that. You can ask me questions, but also I'll be posing questions to you. I know Vida's at work, but sometimes it's good to have this interaction for you to have a better understanding, okay? So key terminology. So first thing, when we talk about safeguarding, what's the first thing that comes to mind for you? Esperance, what do you think safeguarding is?
Protection, protecting
Excellent.
people from harm or abuse.
Yes. So you understand it as protection. Good. What do you understand it as, Bazzy? Bazzy? Oh, she's gone off. So it's, for me, it's exactly the same as you. It's protection. Vida, I know you're at work, but if you can put something in the chat, if it helps you to have a better understanding. Safeguarding is really, really important. Okay, and it's one of the measures that is used in the United Kingdom to protect individuals and their well-being as well. Okay. So when we look at the element of safeguard, it means protecting your health, your well-being, and your human rights, okay? And also recognizing and responding to any sort of risks. You know, if there's any risks in place, make sure we respond to them properly, you know. And it's all about enabling them to be free from any sort of abuse or neglect. And do you think there's lots of issues, Esperance, in regards to safeguarding?
Yeah.
Yeah, not just in health and social care, but within any sector, really, isn't it? And the whole point is to protect and avoid any sort of abuse, but free from any harm. And especially in health and care, social care, there's been lots of instances in care homes. You may have heard stories, Esperance and Vida, where people have been abused, you know, elderly, where they've been abused in care homes and things, and how they need to be protected. And some families also have put cameras in and things like that. So safeguarding is really, really important within health and social care. And it's important that you're trained towards the safeguarding element. So the element of the Care Act is about protecting individuals' rights. It's a legal framework, and it's there to protect adults at risk of any sort of abuse or neglect, and arrange for any sort of representation from any sort of advocates to help them. So, you know, it is there to, again, any public bodies that's acting acting outside their control is where they will protect these individuals, okay? And then we've got 6 principles, which are really important principles, which we'll look at a little bit later on as well. Empowerment, prevention, proportionality, protection, partnership, and accountability. And these are principles that are outlined in the Care Act 2014. And these are things that, they are really important to follow in regards to safeguarding. And, these principles focus on supporting and encourage individuals to make their own decisions and live their own life. So it's really, really hard for some individuals to actually follow them as well, because there's lots of forms of abuse going on. So roles and responsibilities of safeguarding under the Care Act, Section 42. So Section 42 of the Care Act has a duty on the local authority to make any sort of necessary safeguard inquiries when an adult, so anyone over 18 plus, with needs for care and support is experienced any sort of risk or abuse. It's there to support them any sort of, and it's up to the local authorities to make sure that that is their obligation, under legally, it's their obligation to make sure that they, put inquiries in place. So there have been cases for under 18s that I've known of where there was abuse and neglect. So have you heard of the case of a young little girl called Sky, Esperance or Bazzi, Ida? So this little girl called Sky was abused by her parents and she died. And they found over 100 elements of abuse on her body, but also neglect as well. And there's another one that's really important, which springs to mind, is baby P. And that was the youngsters. Now, do you think there's lots of neglect going on in care homes and health and social care, Esperance?
Yeah, a lot.
Yeah. Can you give me an example of something that may be neglect?
I've seen where some people,
Yeah.
in the care homes,
Yeah.
an elderly lady, like, messed his bed, peeing
Yeah.
on the bed.
Yeah.
And someone just came,
Yeah.
changed the pad without even wiping.
Oh, yeah.
So yeah, there was a
Oh,
neglect regarding personal care.
yeah.
Yeah.
It's actually quite sad actually to live in that kind of society, isn't it? That there's so many forms of neglect. Bazizan, do you know any neglect that's happened in your profession, or have you heard of anything?
Yeah, because I don't work in care home
Yeah.
anymore. But like where you tell somebody to do something
Yeah.
and they tell you, oh, I will do later. But when you ask them, they'll be like, oh, I forgot.
Yeah.
Maybe they do it on purpose. They didn't want to do it.
Yeah.
Yeah.
Yeah. And especially if people have language issues, it's really hard, for
Yeah.
them, to get anything across. And, they have a duty under the Care Act 2040, Section 42, that they have a duty to make sure that people are trained up to safeguarding and they are assessing the needs and care of an individual. And there's no types of abuse happening, within the workplace. But again, there is still types of abuse happening, like Esperance said, it's something that they just try to, think, oh, it's okay, we'll leave this person alone because they're old, they don't understand. But it's quite sad actually. We live in a society like that because that's abuse and neglect.
Yeah.
So here's a video that you can watch in your own time, and it looks at what is safeguarding. So it looks at the element under the umbrella of safeguarding encompasses. So you look at that in your own time, please. So 1.1, we look at defining 3 of the different types of abuse. So, we're going to look at 3 more. So there's different types of abuse, okay? You've got bullying, emotional abuse, financial abuse, institutional abuse, neglect by others, physical abuse, psychological abuse, self-neglect, so someone who's not looking after themselves, and sexual abuse. And we look at elements of each one, so you've got a little bit of an idea what each one means. Okay, so the first one is bullying. When we talk about bullying, what's the first thing that comes to mind? What's bullying? What do you think bullying is? Esperance, what do you think bullying is?
It's kind of insulting someone because of how they look or Just their personality.
Yeah, maybe, you know, the behavior.
Yeah.
You know, aggressive, being aggressive towards someone.
Yeah.
And especially at school, it happens quite a lot, doesn't it, among children,
Yeah.
where, you know, they are bullied for any sort of, because they, you know, they may be powerless, you know, it's that kind of abuse. And, you know, the behavior is repeated and children are bullied all the time. And it happens in the workplace. You know, lots of abuse, bullying does happen in the workplace as well. It could be the way you look, it could be culturally, it could be the element of, you know, the others not taking you seriously, others, you know, bullying you because you look a certain way. You know what I mean? So these kind of abuse happens quite a lot. But it's really sad that it happens a lot within the workplace as well. Then we've got emotional abuse, and that's not just anything that could happen at the workplace. It could be anywhere, and it's you know, it's a can involve deliberately trying to, you know, scare or humiliate or isolate or someone. It could be a child, it could be an adult, and it's emotional abuse is often part of other kinds of abuse, which means that it can be spotted quite quickly, you know, the fact that, you know, there's any sort of emotional abuse that happens, and how could it be, you know, how can we identify that? And, you know, emotional abuse is someone who's isolated, someone who's, it's verbal abuse, it could be physical abuse, it could be intimidation, it could be criticizing someone, belittling someone. That's emotional abuse. And then we've got the element of financial abuse, and that is quite a big one actually. That is used quite a lot now, but wasn't used quite a lot before. And it's a form of abuse as having power over you. You know, what kind of scenarios would this be a good thing in? If someone's financially abusing you. I did read an article, Esperance, Bazzi and Vida, about a nurse that took a credit card from an elderly patient and was buying her food with it and everything. And she got caught. You know, so she was using that elderly patient's bank card, and buying things on it. So why do you think there was financial abuse there? Is it because the woman was old? Esperance, what do you think? Do you think it's because the woman was old and she was taking advantage of her?
It could be she was old, or she did not have capacity.
Yes. The mental capacity, yes.
Yeah.
So she was taking the card off her, and it's a form of having power over someone, controlling what they spend, you know, controlling their assets. And this happens a lot in things like, you know, domestic violence cases, where women are controlled by their husbands in regards to how they spend their money. And that's a form of abuse as well. The next one is we're looking at is elements of institutional abuse, neglect by others, physical abuse, psychological abuse, or self-neglect. So the first one we look at is institutional abuse, which is one that happens quite a lot, and it's mistreatment of people brought about by poor or inadequate care or support, such as in nursing homes and things. It can be physical, it can be sexual. And examples is it could or systematic poor practice. So anything that is in the system is abuse, is organizational abuse by the institution, and it's self-neglect or acts of neglect by others. The next one is neglect by others. So this can be acts and omissions by a form of abuse to in regards to care homes. So it could be, you know, care, the support, the protection, which could lead to harm, you know, failing to meet the basic needs. So it could be basic needs like food, shelter, clothing, or medical care, or ignoring a person's emotional or physical, you know, needs, making sure that you are, you know, trying to, because that person may be unable to do certain things, and it's this neglect by others is deliberately withholding that person or failing to provide suitable and adequate care to that person by another adult. It may be through lack of knowledge or awareness, but it does happen quite a lot. And examples of this within the health and social care setting is ignoring medical or physical care needs, ignoring a person's cultural, religious, or ethical needs. Why is that so important? A person's cultural, religious, or ethical needs. Why should you take them into account? Bazzi, why do you think you should take someone's culture, religion, or ethical needs into account?
So we need just to respect their beliefs.
Yes. Why do we need to respect everyone's culture?
Because we
Is
believe.
everyone the same?
No, we're
No.
different. We believe
We are all
different.
different. You have different views. You have different maybe religions and thoughts. I have different religions and thoughts. And if we start disrespecting that kind of stuff, will it help?
No.
No. So we need to make sure that we are not looking at elements of that and trying to, neglect by others in regards to religion, cultural issues. Physical abuse, and that's physically, what's physical abuse, anyone? Physical abuse is the intention to act causing injury or trauma to someone. And it is a form of bodily contact. It's an act of force that results in harm, injury, or trauma of the victim's body. And this can be a range of different behaviors as well. It could be things like, hitting someone, slapping someone, punching someone. That could be an element of it. And then we've got psychological abuse. That's another element, which is emotional and psychological abuse is a person subjecting or exposing another person to behavior that may result in psychological trauma. Can you give me an example of psychological abuse? Esperance? What's psychological abuse?
It's when someone is used to being abused, and then he takes that in his mind.
Yes.
That's how it is. That's how it has to be, and
It could it be mentally as well that they've accepted that.
it causes mentally.
Yeah. It could be any mentally thing, or it could be that they've been manipulated by that person, or controlled by that person, or intimidated by that person. So that could be an element of psychological abuse. And then we've got self-neglect, which is an individual's inability or unwillingness to care for their essential needs, encompassing personal hygiene, health, surroundings, potentially leading to serious health and safety risks. And this is where an individual actually fails to maintain a socially or culturally accepted standard of self-care. So examples of that could be, neglecting their personal hygiene. It could be things like ignoring health issues, or allowing to live in conditions in their house or flat and being, deteriorating, hoarding, or refusal to support. So these are elements of self-neglect. That happens quite a lot. And then we've got sexual abuse. And sexual abuse takes place when a person who knowingly causes another person to engage in a sex act by threatening or placing the other person in fear of someone engaging in sexual act with a person who is incapable of appraising the nature of the act or unable to give consent. So, it's where they've, it's a behavior of sexual nature which is unwanted and takes place without consent. So it could be sexual violence, and abuse can be physical, psychological, verbal, or even online now. It's a big element of it. Examples, like we said, incest relationships, sexual harassment, sexual exploitation could be examples of that. Types of physical abuse could be things like, sorry, just let's go there. So types of physical abuse, it's where it's causing bodily harm to another, and it could be devastating impact on the victim. And the signs, it could be hitting, slapping, punching, kicking, hair pulling, biting, pushing, rough handling, scalding and burning, physical punishments. These are elements of physical abuse. It could be inappropriate or unlawful use of restraint, making someone purposely uncomfortable, misuse of medication, especially in health and social care settings, forcibly feeding or withholding food. Forcibly feeding. What do you think forcibly feeding means? Esperance, what do you think forcible feeding someone?
It's forcing food in someone's mouth.
So give me, is it just anyone, or does it happen a lot to the elderly in care homes?
Yeah, they are most vulnerable.
Yes. And it's quite sad that we live in that society, isn't it?
It's a
Esperance,
shame.
that
It's a
people,
shame.
sorry?
It's a shame, to be honest.
Yeah, it is, because, the elderly were there for us to look after us, but when you go into nursing homes and you listen to some of the stories in nursing homes where families have to put cameras in their parents' rooms to see the abuse that's going on, it's quite sad. And there's an increase in that because these people, remember, you said, Esperance, they are vulnerable, aren't they?
Yeah.
These people can't do anything for yourself, like you said, where they changed a pad for the woman, didn't clean her.
No.
That would affect her later on, wouldn't it? It'll scald her body.
Yeah, they get sore.
Yeah. And it happens quite a lot, and you see it, but sometimes you don't have to walk away from it. It's just sometimes you're in that kind of position where you can't really say anything. I think I would, if it was me, I think if someone did something like I saw, I would say it, even if it wasn't related to me.
For me, I never walk away without saying anything.
Sorry, what's that?
For me, I've never walked away without saying something. I always challenge them.
Good, Esperance. I rate you for that. It's excellent, because if you don't say anything, they're going to walk all over you and do it again and again and again. And you need to be there, and that's really good. If you do that, I admire you for that, Esperance, because it's very difficult for some people to do, to say anything and they just walk away from it. But walking away makes it worse, doesn't it?
But what makes me sad is that because we all have parents, we all have grandparents.
Yeah.
Imagine if that was your mother or your grandmother.
Exactly.
Would you
Exactly,
do the same
Esperance.
thing?
Yeah, I totally agree with you 100%. My parents have both passed away, Esperance, and I see in the hospital how some of the elderly get treated.
Yeah.
And I always think about my parents. What if they were in that position? What if they did that? I was strong like you, Esperance. I will say things back, but people will walk away, some people.
I know.
Because they either have cultural issues, they have language barriers, they can't say anything. And it's very sad.
I just want to say this. I have gone to, I have hidden in the toilet. I just want to say this. I did that.
Yeah.
It happened. I work in a care home, I think one month.
Yeah.
And it happened. And I just complained about it. I wrote it about it. And the person was threatening me that what I've done, he's going to do this to me, blah, 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 blah. But I told him, I'm not afraid of anything. I can die because of this old woman. Because what you are doing here is not right.
Yes,
and it's even a sin. We don't know when someone is doing it. It's not about killing someone.
Yes.
But if you see something and you don't say it, you don't protect the person, it's a sin to you.
It is a sin.
Yeah, because I have been telling him that you have to stop this, and he continued to do it. So I have to complain about it. And he was just threatening me about it. I said, I'm not afraid. I can even die for this woman. I don't care. So it's good to say it.
It's good that you have vocal, because some people, Vida, will say, oh, I can't deal with this. It's okay, it's okay. But it's not okay, because you think about your own family if they were in that position.
Yeah.
And you've got to, and my religion tells me that I have to respect my elders, but also look after my elders as well. And for me, that's really, really important. Maybe, it may be a religious view, it might be my values, my beliefs that my parents put into my head, but that's my belief. And it's really important to me. So the next one we're looking at is types of domestic abuse or abuse. And this is domestic and family violence includes like economic, physical, sexual, financial, emotional. And there's a link there that you could go into that will look at recognizing any forms of domestic abuse. Types of sexual abuse as well. So there's different types of sexual abuse. You could have things like, it could be rape. It could be attempted rape. It could be the fact that, it's inappropriate touching, where they touch you inappropriately, non-consensual masturbation, non-consensual sexual penetration, any sexual activity that lacks any sort of capacity as well. That's really important. And it's elements of that will, look at any forms of sexual abuse. And these are crimes like abuse, rape. We've looked at stalking, could be sexual abuse as well. It's a sexual offense. Honor killings, it's the same word as sexual abuse, and sexual assault is the same word for that. Types of psychological and emotional abuse, and that could be things like psychological and emotional abuse is something that's something, it comes in different forms. It could be the fact that it's abusive language. It could be preventing someone from meeting someone because of their religious and cultural needs. It could be humiliating someone in front of others, calling them names like stupid or something, preventing the expression of choices, failure to respect any sort of privacy, changing the subject, making your needs or feelings unimportant. So these are elements of psychological abuse, and there could be elements of, for example, blackmailing or threats or abandonment, cybercrime, and these can harm someone. If you're caught name calling them and criticizing them, or making sure you don't criticize anyone, because that's a form of psychological abuse as well. Types of financial or material abuse as well. There's different types of financial or material abuse, and this is something that involves things like theft, fraud, or misuse of someone's money, property, or benefits by someone in a position of trust, including coercion or undue related financial affairs. So it could be things like, if you have an old woman who, like we said, had the credit card and you were abusing it for her because she doesn't understand. And like Esperance said, she may have not the mental capacity. Misusing someone's within health and social care, misusing someone's money whilst you're looking after them. Making sure, if someone's got a house, you're coercing that person to make sure they give you the house. It could be anything, exploitation of the person's money, their benefits, someone, misuse of their allowance in the care home. These are things that happen. When we talk about it, I know it's quite upsetting and things like that, but these kind of things happen. Fraud, exploiting someone's money, benefits, denying anyone any sort of assistance to any sort of benefits. Undue pressure. What's undue pressure? Duress. What's duress? Esperance or Bazi Zanvida, anyone? What's duress? Undue influence. Can older people be scared of sometimes the people that they are being looked after?
Yeah.
Yeah, Bazi, can elderly people be scared of people that are looking after them, like care workers?
Yeah, they might be scared.
Yeah. Why would they be scared?
Maybe because the care put that fear in them.
Yes, excellent. Because maybe the care worker has put that fear in them, maybe hitting them, or maybe, shouting at them.
Yeah.
And if you work in the care home, maybe you've seen it, Vida, Esperance, you know, maybe you've seen nurses shouting at patients and shouting at elderly patients, you know, to do this, and oh, you can get up, you can do this, you can, but if they can't do it, they can't do it. You know, maybe Vida, have you experienced that?
Yeah, I saw some in the social media.
Yeah.
That the old woman, as soon as she saw the lady,
Yeah.
she started shouting, "Don't hate me, don't hate me,
Yeah.
don't
Yeah.
hate me,
She
please,
was
I'm
scared.
begging you, don't do that to me."
Why do you think she was doing that?
Because she always do that. She always hate him.
Was she was scared of that woman coming in all the time, wasn't she?
Yeah, she was scared because
Yeah.
she always beat him, beat
Yes.
her. She
Yeah.
always beat her. So
Yeah.
as soon as she saw
Oh,
her, she knows she's going to do that to her.
yeah.
So
So
she
she kind
starts,
of got scared already before it
yeah, she got
happened.
scared.
It's disgusting. It's really horrible, but things like that do happen. Human trafficking, types of modern slavery is things like human trafficking, you know, using people in order to exploit them for any sort of purposes, such as forced prostitution, maybe forced labor, you know, any elements of labor criminality, forced labor. It could be debt bondage or bonded labor. That's the world's widespread form of slavery. It could be child slavery, sexual exploitation, like we said, debt bondage, and, you know, things like forced and early marriage. You know, that could be a type of slavery that happens in today's society, because it's very, very popular. Modern slavery is quite a big thing within the UK, and people can be enslaved, making things like, you know, in different countries, but within the UK, modern slavery is quite a big thing. And there's a link there to gov.uk which looks at identifying and reporting modern slavery. Types of discriminatory abuse. So discriminatory abuse involves things like unequal treatment of a person based on their religion, disability. It could be their race, sexual exploitation. It could be elements of verbal abuse, denial, or unfair treatment. It could be a verbal abuse and any sort of remarks, appropriate language, unfair treatment of someone, denying someone communication aid. So if someone's deaf or needs lip reading, you know, denying them is a form of discriminatory abuse. Harassment, you know, intimidating someone, unwanted behavior that's offensive. Denying basic healthcare needs as well for someone. Harassment, ignoring someone's view, denying them their basic rights, you know, making sure you, you know, are giving someone their rights. You know, that's really, really important within health and social care, you know, making sure you are looking at, there's different forms of discrimination. There's direct discrimination, indirect discrimination, associative discrimination, and perceptive discrimination. And that happens within the health and social care, where maybe someone treats someone unfairly because they're different. Maybe they have a different culture, maybe they have a different religion, maybe they have a different skin color, and people treat them badly because of that. And that happens everywhere in society. That happens so much that you learn to accept it, and that happens, you know, wherever you work as well. Types of organizational or institutional abuse, and encompasses this is neglect and poor care practices within a specific care setting, such as a hospital or care home, like we've talked about, or even in a person's own home when they're receiving care. It can manifest as a single incident or repeatedly occurrence due to the poor policies, procedures, and practices. And like Vida was saying, that woman saw that woman and she screamed or got upset. That woman has been abusing that woman for a long time then. It's not something new. It's not a one-off incident. It's an incident that's been happening for a while. So things like, you know, it could be neglect and poor care practices, poor and unsafe environments, rigid routines and lack of choice, lack of dignity and respect, inadequate staffing and training could be one, abusive and disrespectful attitudes towards people using the service, inappropriate restraints. You know, these are forms of institutional or organizational abuse that happens. You know, lack of leadership, maybe poor record keeping, not putting care plans in place for them. You know, that sometimes happens in certain care homes. At one time, people were set in care homes because it was so easy, but they weren't looking after the actual patients around it. Types of neglect and acts of omission. So neglect and acts of omission are when someone fails to meet the needs of another person. And this can be intentional or unintentional. And this could be physical neglect, withholding food, water, or shelter. It could be things like medical neglect, not administration medication or arranging medical appointments. Emotional neglect, not responding to a person's emotional needs. Educational neglect, not providing access to educational services. Self-neglect as well. So these are things that can happen within the health and social care profession, you know, where there's neglect happening, not taking into account, you know, the individual's health care, not taking into account their health needs, what medication they need, you know, not taking into account, you know, failure to provide them any sort of medical care, including, you know, timely diagnosis, treatment, or medication, and not supporting them. Why do you think, Esperance, emotional neglect is really important when you're not supporting someone if they're distressed or if they find out they've got an illness? Why do you think that's so important?
Excuse me. It's very important because being emotionally abused, or feeling like you're not protected, it leads to mental illnesses.
It leads to a lot of stuff as well, you know, like, for example, if you work in Esperance in a care home, why do you need to make sure you have taken into account someone's hygiene, nutrition, or medical care? Why do you think they are so important? The person's hygiene, you know, like you're talking about the woman with the pad. Do you think that's hygienic?
No, because it causes so many issues on her skin.
Yes.
She can get sore where she's lying because, you know, too much fluid down there. It causes to get sore.
Yeah.
And that can develop infections and
yes, especially if they're already poorly.
Yeah.
And that's a type of self-neglect. The next slide. So, you know, neglecting someone, not bathing them, not brushing their teeth, not maintaining their hygiene, you know, neglecting someone's clothes, inappropriate clothing, their body odor, making sure they're clean. You know, if it's someone who's not eating, making sure they're eating and drinking properly. You know, ignoring, failing to seek any sort of medical advice or take prescribed medications. So, you know, you need to make sure that when it comes to self-neglect within health and social care, you as a worker are looking after them individuals. You know, you're making sure that you know, nutrition, they've got enough food, that then, you know, there's no that they've got they're not refusing to take any sort of medication. And there's a link there to self-neglect that you can actually go on, and it will look at the elements of it, you know, and people do self-neglect, but you shouldn't be doing it in your workplace. 1.2, identify signs and symptoms identified with 3 types of abuse. So we're going to look at types of psychological or emotional abuse. So when we look at psychological and emotional abuse, there are different types of psychological and emotional abuse. So, you know, psychological abuse is a form of abuse categorized by a person subjecting or exposing another person to a behavior that may result in psychological trauma. And psychological abuse can be verbal abuse. It could be name calling, insults and threats, gaslighting, making the victim doubt their own reality, their memories, especially elderly patients. If they've got dementia, you know, you're making them doubt their memories or, you know, their own reality, and you make them feel like if they're not understanding anything, you know, you make them feel you're gaslighting them. Isolation, so preventing the victim from accessing services. Humiliation is another form of psychological abuse. Control, failure to respect people, and bullying and intimidation. You know, emotional and psychological abuse are serious problems and can have a devastating impact on the victim. It's important to be aware of the signs and symptoms, which is the next slide, to look at things like, you know, signs and symptoms, so that, you know, you can help them, someone who maybe experienced that kind of thing. So some emotional and psychological abuse indicators are things like, you know, silence. There may be an air of silence when a particular person is present. So like you said, Vida, that woman is present on the internet when you saw her, and that other elderly woman was scared of her. So that's her presence. You know, this person is, the victim is unable to speak up or is unable to say anything because she's, you know, she's in fear of intimidation. The other one is withdrawal. So the victim may withdraw from social activities, become isolated from friends and family, and changes in their mood or behavior. And insomnia, so the victim may be trouble sleeping or experiencing things. Low self-esteem. The victim, if you know, if they're being abused, will have low self-esteem. They'll be aggressive as well. Why would they be aggressive, Esperance? Why does someone become aggressive if they feel like they're being, you know, if there's been any sort of psychological or emotional abuse?
Because they are used to self-defense.
Yes. Used to self-defense, yes. Changes in their appetite. Sometimes they'll stop eating. You know, weight loss, weight gain, signs of distress. You know, the victim may show signs of distress, tearfulness, anxiety, or anxious. Our false claims, someone involved in the victim may make a false claim, you know. These are psychological abuse, can be damaging, as we said, and it's difficult to break through it sometimes. You know, the people find it very hard to move away from that. Why do you think they find it hard to move away from that kind of abuse? It's very hard because you're so, if you're in a care home, you're there 24/7, and you're scared that that person's going to say something or do something to you. So you'd rather just keep quiet. So we've got types of domestic abuse. We've got domestic abuse, obviously, is the element of includes abuse, including economics, physical, sexual, emotional, and psychological. It could be towards children, it could be towards adults, and it could be towards elderly as well, or intimate partners. Violence includes stalking, sexual, physical violence, and psychological aggression by a current partner or former partner. So the signs and indicators for that is really important when you look at domestic abuse. There's lots of signs and indicators for domestic abuse. Things like, you know, low self-esteem, things like, you know, undermining the individual's self-confidence, verbal abuse. It could be physical evidence. So physical evidence can be things like bruising, maybe broken teeth, broken bones. That person doesn't want any sort of intervention from the outside. They don't want to talk to people, any sort of damage to their property. They are isolated from their family as well. And, you know, these abusers will isolate these people to make them feel, you know, helpless. And, you know, they may be, you know, they can't do anything. You know, there's a sudden change in their character as well. You know, you can identify that if someone's had elements of, you know, domestic abuse. They can be quite withdrawn, you know, and you can tell straight away the people that, you know, are moodiness or agitated or disoriented, or especially if they see someone, a partner or something, and they feel like, you know, they are, you know, disoriented because of that partner, you know, and they're scared of that partner. And we look at, you know, elements of, you know, someone regarding everyday behavior. You know, their behavior may be that the fact that, you know, they are, you know, withdrawn, you know, they're paranoid as well. And, you know, sometimes it could be the element of them not having, you know, the fact that they've got the bruises to identify that. So domestic violence and abuse includes incidences of controlling cohesive behavior. And it could be, cohesive behavior can be acts of assault, threats, humiliation, intimidation, harming someone, you know, physically harming someone and punishing someone. You know, people want to control that person. It's very sad, you know, when it comes to domestic violence, that that person is not able to say anything. Their behavior changes, you know, the way they say things change, you know, and, you know, it could happen to anyone, regardless of their age, their gender, their background. It could be men, and that's a big increase now at the moment. You know, men are abused quite a lot. Why do you think men don't call out, say anything if they've been abused, Esperance or Bazin or Vida? Why do you think men don't say anything?
Some men in their cultures, it's a shame to be abused by.
Yeah. It is, it's a shame thing, isn't it?
Yeah.
But it does happen, you know, and abuse, you know, domestic abuse or any sort of abuse could be things like honor-based killing, you know, and honor-based violence. It could be female genital mutilation or forced marriages. You know, in the UK, female genital mutilation is a big thing, you know, the fact that it's a form of abuse, you know, and it does happen. Children are subjected to that in the country. I know it happens in certain countries, you know, outside of the UK, which is a traditional thing maybe and a cultural thing, but it does happen in the UK as well. Not as much because there's laws in place to protect people, but it still happens. And I've known people that it's happened to, because I work with a big organization that deals with women that suffer domestic violence, but also women that go through FGM. So we work with the police to try to prevent any sort of element of abuse happening to them young girls or women. Types of physical abuse. Physical abuse could be things like assault, hitting. It could be, you know, scalding someone. It could be elements of, you know, physical punishments, inappropriate or lawful restraints, making someone feel like, you know, they don't have a purpose in life. You know, abusing someone. You know, it's really, physical abuse is a big thing. You know, hitting and slapping someone. You know, making sure that, you know, that person, you know, attacks them physically or without a weapon, or can be punching, throwing things. It could be the use of weapons. And in an abusive relationship, it could be you punching the person or slapping the person or biting the person, strangling or choking the person. You know, that could be a physical abuse. In the could that be what could be a physical abuse within the health and social care setting? What do you think could be abuse within health and social care setting? Esperance, Bazzi, Vida, anyone? What do you think abuse, physical abuse could be within health and social care setting?
It's not like maybe you slap the patient.
Yes, you slap the patient. If it's an elderly patient, you slap them, you push them, you know, deny them any food or water. You're not taking them to the bathroom, you know, you're not giving them medication. That's a type of physical abuse that would happen within health and social care settings. You know, and there are physical indicators of abuse as well. You know, the fact that there's bruising, there's cuts. So if someone's fallen, you know, the injuries inconsistent with their lifestyle, bruising on their bodies, frequent injuries, unexplained falls. So if someone's falling all the time, Bazizan, and, you know, is that an indicator that they're being abused?
Yeah.
Yeah. If someone's got a black eye all the time, or a laceration, or broken bones, you know, or if someone, you know, is that a form of abuse as well?
Yeah.
Yeah. So, you know, these are indicators that would help someone identify if there's any forms of abuse happening. You know, it's easier said, but it's very hard for someone to identify sometimes. And if you're not diligent and you don't, you're not looking at these signs and you're just ignoring it and doing your job, then are you doing a good job, Esperance? If you're not, if you're ignoring everything?
No.
No, you're not doing a good job, are you really? And like Vida said, there's loads of things on social media that have shown that people have been abused quite a lot. And families have taken this into account, but families are quite concerned and then have put cameras in place for these things because it's happening quite a lot. So, these kind of things happen, but, elements of, why there's elements of that in regards to it. So we've finished learning outcome 1 now. So just a recap on what we've done. We've looked at understanding how to recognize signs of abuse or harm. We looked at what safeguarding is. We looked at the Care Act and the 6 principles of safeguarding, the role responsibilities of safeguarding. We looked at defining bullying, financial abuse, institutional abuse, neglect by others, and we looked at physical abuse. We also looked at self-neglect and sexual abuse in regards to what it is and what it identifies. And examples, we looked at types of domestic abuse or violence, and we looked at psychological or emotional abuse and types of financial or material abuse. We also looked at types of modern slavery, and there was a link that you could go on in your own time. Types of discriminatory abuse, and we looked at types of organizational or institutional abuse. We also looked at identifying 1.2, the signs and symptoms identified with 3 types of abuse as well. We looked at types of domestic violence abuse with signs and indicators, and looked at elements of physical abuse with signs and indicators as well. And finally, we looked at elements of the signs and indicators for domestic violence as well. So have you got any questions before we finish this session? And then we've got tomorrow's session at 3:30, learning outcome 2. Have you got any questions, Vida, Esperance, Azizan?
No.
Okay. Esperance?
No, thank you.
Thank you. These are the references.
Please, can I ask, tomorrow's section, you said what time?
It's at, let me just have a quick look. I think it's at 3:30. That's the only session that's at 3:30 tomorrow.
Okay.
The rest of the sessions are all at 10 o'clock, okay?
Okay.
So these are the links and references we've used for today's session that you can go on to and have a look at. Refer to ebooks and journals on Moodle for this unit. There's a link there that you could have further reading that you could go have a look at if there's any sort of further reading you want to do. A lot of the additional stuff, all the assignment brief, these learning outcomes when they're recorded will be put on Moodle. And if you have any questions or anything, please email learnerwork@ukvarsity.co.uk. Please go on to the ebooks and stuff on Moodle. If you have issues accessing Moodle, email learnerwork@ukvarsity.co.uk. Thank you for attending today's session, and it was lovely teaching you all. And it was an interesting session as well. And again, any questions, email learnerwork@ukvarsity.co.uk. And the next session we've got is tomorrow's session, which is learning outcome 2. Anyone got any questions before I disappear? Any questions? Thank you for attending today's session, and I will see you tomorrow. Thank you.
Thank you.
Thank you.